Ladies and gentlemen, what if I told you that your knees, no matter your age, no matter your past injuries, still have untapped strength, still have the capacity to heal, to stabilize, and to support you through every step of life? Today, we're not just talking about exercises, we're talking about taking back control, about rewiring your body's relationship with pain, rebuilding your strength from the ground up, and restoring the freedom to move without fear. Pain is not the final word. It's a message, one that your body wants you to decode, not fear. If you've been told that knee pain is just a part of aging or something you'll have to live with, let today be the day you challenge that belief. Because your knees, your joints, your ligaments, your tendons are incredibly adaptable. They respond to the right inputs. The problem is most people either avoid movement completely out of fear or they move incorrectly, reinforcing the very pain they want to escape. But you're not here to avoid, you're here to evolve. And that begins with understanding something powerful. Pain is plastic. It changes based on what you do, what you think, and how you train. Your brain is constantly rewriting its map of your body. And when you start feeding it with the right exercises, so how do those maps begin to shift from pain to power, from restriction to resilience? The two exercises I'll share with you today aren't flashy. They're not complex, but they are clinically proven, brain and athlete approved. Why? Because they retrain the control system, not just the muscles. Exercise 1, wallsit. Isometric quadriceps activation. You don't move, you just hold. But while you're holding, you're lighting up the stabilizers around the knee, restoring blood flow, improving tendon integrity, and reactivating dormant fibers that have been asleep, sometimes for years. 30 seconds a day can rewire months of disease. Exercise 2, terminal knee extensions, TKEs. This movement targets the end range quad engagement, the critical zone for knee stabilization. Every rep teaches your nervous system how to control the joint with precision. Over time, pain is replaced by confidence. Instability becomes strength. You may not notice a radical change on day 1, but that's not the point. The point is, every time you do these movements, you're sending a signal. We are building strength. We are taking control. We are not done yet. Your knees have carried you through so much, through life's pressure, through hard seasons, through every step you've ever taken. It's time to return the favor. You don't need perfect genetics. You don't need endless hours in the gym. You just need the courage to move deliberately, to train intelligently, and to stay consistent. Even on the days when it feels hard, this is how you stop knee pain, not someday. Now, let your body feel what it's capable of again. Let your mind believe in that possibility. And let your knees become the foundation of your comeback. Neuroplasticity works both ways. Pain can be unlearned through deliberate and repeated exposure to safe, corrective movement patterns that rewire the brain's interpretation of bodily signals. Chronic knee pain, for example, often starts as a legitimate signal of tissue damage or inflammation, but over time, the nervous system can become hyper-responsive, encoding the pain as a persistent warning even when the original injury has healed. This is because the brain begins to associate certain movements, positions, or even thoughts with pain, reinforcing those neural pathways each time discomfort is anticipated or experienced. However, the same mechanisms that encoded the pain also be used to deconstruct it. By engaging in focused neuromuscular retraining, exercises that teach the brain new, safe associations with motion, individuals can effectively reduce the intensity and frequency of signals. This is not merely psychological. It is a measurable structural adaptation in the sensory and motor cortex of the brain. The neural circuits that once screamed danger can be dampened or even silenced when given clear, repetitive evidence that movement is now safe. Breath control, visual focus, and proprioceptive feedback all contribute to reshaping the sensory-motor integration process. When combined with low-impact exercises that activate stabilizing muscles around the knee joint, such as isometric contractions and slow eccentric movements, these signals gradually teach the brain that the knee is strong, reliable, and no longer in threat. Pain then shifts from being a dominant state to a background signal and eventually to silence as the nervous system adapts to the new input it receives. Joint pain is often a signal, not just damage, and understanding this distinction is critical for long-term recovery and mobility. While it's tempting to view pain as a direct indicator of structural harm, like cartilage wear, ligament tears, or bone-on-bone friction, the truth is that pain perception is filtered and amplified by the central nervous system based on a multitude of factors, including prior injury, stress, inflammation, sleep quality, and even fear of movement. The knee joint, for example, can produce pain in the absence of visible damage on imaging, while significant structural deterioration might exist in other individuals who report no pain at all. This is because the brain uses pain as a protective mechanism, sort of internal alarm system that often becomes hypersensitive after injury or prolonged disuse. When certain tissues are underused or perceived as vulnerable, the nervous system may generate pain signals to prevent further strain. Even when no active damage is occurring, this is particularly true for people who have developed compensatory movement patterns where the knee begins to absorb forces that should be distributed across the hickles and core. Over time, this compensation creates mechanical stress and nervous system hypervigilance, reinforcing the pain loop. Importantly, this signal can be turned down or modulated by improving tissue tolerance, restoring joint alignment, and reintroducing controlled movement to re-educate the nervous system. Techniques such as progressive loading, isometric holds, deep diaphragmatic breathing, and proprioceptive feedback are powerful tools to reassure the body that movement is safe, that the joint is supported, and that pain is not an accurate reflection of threat. Isometric holds reactivate dormant stabilizers by targeting muscles that often lose engagement due to injury, chronic disuse, or altered movement mechanics, particularly around joints like the knee. These deep stabilizing muscles, such as the vastus medialis, oblique VMO gluteus medius, and intrinsic foot musculature, are responsible for fine-tuned joint control and balance, yet they're often overshadowed by larger, more dominant muscle groups. When an injury occurs or pain is present, the body naturally compensates by shifting load away from the painful area, leading to a shutdown or inhibition of these stabilizers. This neuromuscular silencing causes joints to become less supported and more vulnerable to dysfunction over time. Isometric exercises, which involve holding a muscle contraction without changing joint angle, allow for maximal muscle fiber recruitment in a safe, controlled way. These holds eliminate momentum and reduce the risk of re-injury, making them ideal for rebuilding neuromuscular connection. By sustaining tension in a specific joint position, the nervous system receives a powerful proprioceptive input that signals the brain to reestablish control and re-engage neglected muscles. The static nature of isometric work allows you to dial in mental focus, increase time under tension, and stimulate tendon remodeling while simultaneously enhancing the mind-muscle connection. This focused engagement helps recondition the stabilizers to fire appropriately during dynamic movement later on. In the case of knee pain, exercises like wall sits or single leg isometric glute bridges can be used to wake up these dormant pathways, leading to better alignment, reduced compensatory strain. In a more stable joint that can begin to move with both power and precision again? How do we mind-muscle connection enhances structural strength by actively engaging the brain in the process of muscle activation? How do we turning each repetition into a neurological training event rather than just a mechanical task? When you consciously focus on a specific muscle during movement, like the quadriceps during a knee extension or the hamstrings during a hip hinge, you increase motor unit recruitment within that muscle, meaning more fibers are activated more efficiently and with greater force control. This heightened neural drive improves the quality of muscular contraction and refines the coordination between the brain and the musculoskeletal system, which over time leads to structural changes in both the muscle tissue and the supporting tendons. The enhanced signaling from the nervous system improves synaptic efficiency and accelerates adaptation, especially in underutilized or weak muscles that often go dormant due to compensatory patterns or pain. For example, when dealing with knee instability, simply going through the motions of leg exercises may not reactivate the vastus medialis or lateral stabilizers unless the individual deliberately focuses on contracting those regions with intention and control. This mindful engagement reshapes motor maps in the brain and helps to reestablish proper kinetic sequencing, allowing joints to move with better alignment and force distribution. Over time, the brain learns to fire these muscles faster and more precisely, which translates to improved joint support and decreased injury risk. This internal focus also elevates the effectiveness of rehabilitation and strength training, turning basic exercises into powerful neurological tools that reinforce structural resilience and correct dysfunctional patterns developed through years of poor posture, trauma, or sedentary behavior. Trainees don't heal in isolation the system by recognizing that the knee joint functions as an integral link within a complex kinetic chain involving the hips, ankles, core, and even the feet. When pain or function arises at the knee, it is rarely the fault of the knee alone. Rather, it is often a symptom of imbalances or breakdowns elsewhere in the chain that force the knee to absorb loads or perform tasks it wasn't biomechanically designed to handle on its own. Weak glutes, tight hip flexors, limited ankle dorsiflexion, poor foot stability, and insufficient core activation all contribute to compromised knee mechanics as the body shifts force and strain to maintain movement in the presence of these deficits. How do we key. Training the knee without addressing these surrounding structures is like trying to stabilize a bridge by reinforcing only the middle. It misses the foundational supports that truly determine long-term integrity. Functional movements that integrate multiple points and planes of motion, such as step-ups, split squats, and glute bridges, are far more effective in creating a resilient system than isolated leg extensions or machines. Equally important is retraining neuromuscular coordination through balance work, proprioceptive challenges, and rotational movements that mimic real-world tasks. This approach ensures that muscles fire in proper sequence, joints remain aligned, and compensatory patterns are gradually dismantled. Addressing the entire kinetic chain restores natural force distribution and joint centration, reducing excessive shear or torque on the knee during walking, squatting, or stair climbing. Breath mechanics, spinal alignment, how do we, and even visual orientation influence how the body loads the knee joint, and all must be considered in a comprehensive healing process. By restoring optimal function to the entire system, the knee is no longer forced to compensate, and healing becomes a full-body recalibration rather than a localized repair attempt that fails to address the root cause.